today I'll be giving a talk on virtual reality in spinal cord injury from paper to practice. So before we know, actually, I always believe in this, as like noble thoughts come to us from every side as we are having this conference started yesterday till the 19th. I think there'll be a lot of noble thoughts which will be there and which we can put in practice as well. So we've all heard enough about virtual reality. So I just want to take a moment, all of us to take a moment and look at this picture. Like I can see a picture where a person is sitting there, and it's actually, you all see it's a metro train. So we are going to start the virtual journey now from here. So till we finish, it's going to be a virtual journey. Definitely, it is indeed virtual because we are presenting it virtually also. So we've heard so much about virtual reality. When you go to a mall or any place, you find people and children jumping on it, enjoying the virtual reality. But when it comes to rehabilitation per se, we are now going to look at it how virtual reality has played a significant role in rehabilitating people with spinal cord injury. So just little brief thing about, because from what it started as virtual reality, we know where we use interactive simulate environments. The information can be provided of the same senses existing in the real world to obtain information about the virtual world. So I put on this definition specifically because from where it started and to now what's happening, there's been so much of changes and modifications that have taken place in terms of technology. So if you can see the main indications for virtual reality in spinal cord injury, number one, it helps to improve the motor function. Primarily, it is used to reduce pain, mainly the neuropathic pain, to improve balance. Then definitely it has had a great deal in improving the psychological outcomes, and it provides a lot of physiological feedback, thereby it enhances functioning as well. These are the main indications for virtual reality in spinal cord injury. So one, it is used as an analgesic in acute and chronic pain. Definitely there are pharmacological measures which helps in combating pain. When it comes to neuropathic pain, so virtual reality is offers a great result. Definitely the immersive virtual reality gives promising results. So if we take virtual reality, we have the non-immersive virtual reality and the immersive virtual reality. When it comes to complete immersive virtual reality, it helps a great deal in combating pain. So if you can just see here in this picture, you have a person having a headgear and the controls here and the game which is there. So this is actually a virtual reality platform which happens where the person is trying to play in the form of a game which is very stimulating for the person as well. I just put this picture. So there are different forms of virtual reality where we can modify and customize the games according to the needs of the person. So we can we see some tomatoes coming here, and then a person is trying to catch, or a person is trying to catch a ball. So these games can be adapted to the age of the person and according to the interest of the person as well. So that is one main advantage I see in virtual reality, because in a pediatric setting it will be completely different, or for adult it will be completely different. We can choose exactly what we want. And as occupational therapists, we always focus on optimizing function and also improve their day-to-day functioning. So in terms of that, what we have is specific tasks related to the activities of daily living, or we have the instrumental activities of daily living. For example, boarding a bus or transportation, other things. So they're exposed in the virtual environment before we train them into the actual environment. So it's really virtual environment, then we have a simulated environment and the actual environment where they're actually taken back. So when we train them in the virtual environment, and in the when they go, there are promising results and a significant improvement as well, which is noticed. And adaptability is much more quicker in persons with spinal cord injury when you train them in a virtual platform. So this is something with study which I wanted to show. There are many studies, but I'm just putting the salient and the most important studies. This is a systematic review which focused on virtual reality for spinal cord injury and how it affects the pain. So they identified more than 333 studies, and out of which they found they used VR augmented training, virtual illusion, and VR hypnosis for treating neuropathic pain. So, and they found that 4 studies supported virtual walking, and the VR methods were each supported by a few other studies. So what they said is there was significant reduction in the neuropathic pain from these studies. And so now the VR training of upper limb function after spinal cord injury can also provide adjunctive rehabilitation methods, and there are no significant adverse side effects noticed. That's one hallmark feature I want to note here. So, I'm not sure. I'm sorry, the video is not playing. This is a place where you can see where we are working on the upper limb function of a person. Where this person is holding on to a pulley like thing, and the person actually pulls down, and there will be an activity which will be happening in the front. It's in the monitor which the person can actually see. So that's what happens here. And this is the whole setting. You can see, especially train the hand functions on the upper limb. You have different series of things. So these would be graded in terms of the functioning of the person and the ability that the person has got. So each of this they can hold and they can. So we can see earlier we had a pulley like where they can insert the finger and then pull. Here we have something where they will be holding on to it and pressing it. So then actually it will move. That is how it is. This is again another study which was done December 2020 just published, where virtual reality systems for upper limb motor function recovery in persons with spinal cord injury. So they wanted to find out the virtual reality effectiveness of VR on upper limb motor function when compared with the conventional physical therapy. So definitely there was significant improvement in the upper limb functioning. Again, there was another study which wanted to identify the beneficial effects of VR therapy to enhance sitting and standing balance. And definitely it showed a trend of gait improvement in individuals with spinal cord injury. So these are the different things, tasks which can actually be used in virtual reality. I just highlighted a few things. It's the foot bag, then the hamster splash, like we find hamsters going up the toes, and they've asked to flex the ankle and launch each hamster into a swimming pool. Like, so it can be made. So different games can be used. It can be adapted to the culture. So there's a few things I've just highlighted here. So because children love cars, and so cars are moving, and how they try to avoid touching the cars by making just the foot movements and the moving away of the legs. So one thing is in virtual reality, few things, how the activities are graded, how it has been set, one in terms of the acceptance level, and they also been identified based on the performance, and the level of pain are taken into consideration. So this is one thing where you have this is an immersive VR where you have the full thing immersed, where they probably sit on a bench and try to, it's a pop-up watch. So every time it pops up, they have to crash it. That's how it is. And this is another study where they identified the effects of VR and balance ability in individuals with incomplete SCA to identify the efficient training protocol. So this also. So finally, ultimately concluding why VR. One important thing is through VR, we can offer 24/7 support, because once the whole system is set, the person can actually handle himself or herself. So continuously they can involve, and definitely enhances motivations to do gamified tasks. Anything in the form of game would be interesting. So definitely it would improve motivation, and it's definitely time and cost saving. So for a person, if you set it, and they can be actually involved, but not necessarily we have to be with them throughout the day. So they can do it as and when they want. And cost serving in terms of if they have to go to a therapist, something, the cost would be more. So through VR, actually, we can actually make them do that. In terms, it's cost saving. And other things, we can give a personalized and customized care for the individual. So having identified what their strengths are, what their functions are. So with that note, I just want to conclude by saying we are breaking and rebuilding, we are growing and always guessing. So in terms of technology, I think, so ultimately the way forward will be for us to innovate. We need to inform, because one of the things is there are not much of randomized control trials which are available. So probably in terms of research, we need to have more of randomized control trials, and let's keep inspiring people. So thank you everybody. And one thing I want to highlight here in terms of cost, just the normal headset and the gear, it's very, very, very less expensive. You can get it even 5,000. It can range up to 2,000, 5,000, 10,000 too. Or if you want to get up a complete VR per se, so full-fledged, it takes around 20 lakhs to 30 lakhs. So the cost range available. So depending on the need of the person, we can just do it. So thank you once again for the active listening, and thank you for having given me this opportunity.